Namaskar. This is Dr. Sunil Kumar Paudel. Today we are going to talk about disc prolapse, slip disc and nerve impingement. I am going to tell you a secret about disc prolapse and nerve impingement. Today we are going to talk about a very different subject. Is it possible for slip disc or pinched nerve to heal by itself? In my more than 20 years of experience in Nepal, UK, Caribbean and USA, I found it to be true. And I've also researched many research papers. I've gone through hundreds of papers and I found it is possible. In my personal experience of more than 20 years, I've seen hundreds of slip disc patients get healed by itself. What it is, we are going to talk about that. The body, our human body, has got an innate mechanism. We call it the body heals itself in natural medicine. It is true. If you have got a small wound or scratch or bleeding or it's fractured, you keep it clean, let the body have enough time to heal itself, it heals itself. The doctor is not doing any magic. When the doctors were not even there, how did we heal then? How did we heal our fractures or wounds? Because if anyone keeps it clean and let the body work on it, or if there is fracture, just keep it supported so that it doesn't move. The body heals itself. The wound heals, the fracture also heals. The same mechanism also applies on our disc. We already know the disc is fibrocartilaginous substance, a joint, and because of the excess pressure it can slip out. The way it slips out, it can slip in and fix itself. Okay, what are the mechanisms and how many research papers are done? We'll go through a few of them just to make you clear. Do you know that while breathing, we are breathing in millions of microorganisms, bacteria, viruses, fungus, so many organisms, but you don't get that disease. How? Because the body has got an immune response. The body has got the fighting abilities, killing those germs and keep our body always healthy. And with this mechanism applies to disc prolapse, fractures, wound healing, bleeding, trauma, many things, infections. So with this mechanism also applies to disc prolapse. What do you call slip disc and nerve impingement? So, but we need to give the body a chance. If there is a wound, if you follow my formula and let it heal, it will heal by itself. But remember, if you start scratching, putting dirt on it, will it heal? No, it will never heal. It will lead to more infection and you might die out of a small wound. If it gets infected and you get sepsis, you might. So you need to give body a chance. That is to keep cleanliness, and there are certain disciplines that you need to follow. For fracture, same thing. You cannot walk the second day in fractures. So same thing applies to slip disc and nerve impingement also. So there I'll outline a few disciplines. If you follow that, I am certain that you are going to heal your slip disc and nerve impingement by itself. The first step when there is slip disc or disc prolapse, the first thing that happens to our immune system is it identifies the disc fragment as a foreign fragment or foreign body. So when the body identifies it as foreign body, it starts attacking it and starts eating it. This activity is called macrophagic phagocytic activity. This is done by our white blood cells and it starts happening spontaneously. In these slides, and I've done lots of research on it, and also I've got many patients pre and post. 2 times I've done MRI and I've found that it to be true. Even the larger fragments start disappearing slowly, slowly, slowly. And when I researched, it was very clear, very obvious that the body identifies that fragment as foreign body and starts attacking it and starts eating it. And this is the first response that happens, and this is also the last response that happens. It starts very slowly, and very slowly the whole fragment gets eaten up by our own body's immune response. It is almost like you have got wound and you have got some pus, and the second day, third day, there is no pus. It's the same activity that happens at the disc too. The moment there is some damage, disc prolapse or slip disc is also a damage. The moment body identifies there is a damage, there will be a response that is called inflammatory response. The earlier in stage 1 I told you about phagocytic macrophagic activity. There will be other white blood cells like monocytes also coming to that area. So whenever there is damage, you can see there is swelling. Okay, because of the high influx of blood and nutrients, it gets swollen. And then it will be hot also, because the body starts working on that area. Human body is slightly defected because of our artificial diet, artificial lifestyle, and artificial we have created an artificial nature itself. Okay, because of that, the healing response cannot be very 100% complete, and the healing response stops. With the guidance of a specialist or expert, we can guide you through the whole healing response and whole inflammatory process to be complete. That's another secret that happens. And in this inflammatory response, there are hundreds of mechanisms that are getting discovered by scientists. We'll come to a few vital mechanisms. The third response is absorption of water. Disc has got high component of water in it. So the moment there is slip disc or disc prolapse, the disc starts going out, and the body compensates by absorbing the water. While absorbing the water, the disc starts shrinking. So that's another healing mechanism. Okay, I'll show you this in picture also. So in T2 of MRI, T2 image, where the fluids are seen highly hyper intense or white, in this image you can find your discs are black. That's called dehydrated or desiccated disc. This is one of the healing mechanisms. Though this also happens while you sit for too long, while you torture your disc for too long, or you keep bending forwards. But after disc prolapse, also naturally in healing mechanism this happens. The body absorbs the water and shrinks the disc slowly. This is another mechanism. There are also few natural processes that happens just after prolapsed disc or pinched nerve or slip disc. Okay, so I've gone through many researches and I've found few of these processes very vital for self-healing of the disc. Few of the response are called natural process, like the moment disc hits the epidural space, it evokes the autoimmune reaction. Okay, the autoimmune reaction also facilitates the inflammatory process. Also, it starts producing MCP1. MCP1 are also called monocyte-derived chemoattractant proteins. The macrophagic activity, this stimulates the macrophagic activity, and macrophages starts eating up the things and it starts healing and repair that. Another activity is also called plasmacytoid dendritic cells activity. This is also the very repair mechanism that is happening. In the herniated disc, the macrophages start producing TNF-alpha. That's also called tumor necrosis factor alpha. We have already talked about MCP1. There will be also production of MMPs that are also called matrix metalloproteinases. There will be high production of interleukin 6 and 8. There will be production of prostaglandins E2. They are also called PGE2. Cyclooxygenases 2. Nitric oxide. These all will contribute to the inflammatory reaction and the resorption of the herniated disc, the disc prolapse or the slip disc starts getting resolved. But we cannot identify what is going inside. That's why sometimes we might suppress that. So if you come to me, I'll tell you about the postures, exercise, diet, lifestyle, and other things that are associated so that these activities and these mechanisms are stimulated so that the self-healing happens faster. So it is made out of lots of collagen and proteoglycans. The moment it ruptures, there is another mechanism that's called the matrix remodeling that helps the fibers and collagen start joining together. If you are guided by an expert, then if you are properly guided through lifestyle, diet, postural care and other natural treatments, this process of matrix remodeling can be stimulated so that the body and the disc can heal faster all by itself. And I'll do that process. Usually I guide people to the precise postural care, because in different conditions of disc prolapse, different kinds of disc prolapse or slip disc, there should be different procedures and different diets according to your constitutions need to be followed. This process of neovascularization and hypereffusion should be stimulated through many processes. Sometimes many of the patients have got pre-existing conditions like diabetes, hypercholesterolemia, dyslipidemia, your cholesterol triglyceride levels are very high, thyroid disorders and other things that hamper the healing response. Then we may have to use some herbs to stimulate that process so that the new blood vessels are made there and it leads to healing. This process, sixth process, is also called Neo Vascularization. So we need to understand that like other ligaments, disc is also not supplied directly with any blood vessels. The moment there is disc damage or disc prolapse or a ruptured disc or slip disc, there is a process called neovascularization. So the blood vessels start getting formed. So we use lots of herbs, and we also need to work on any pre-existing conditions like diabetes or cholesterol problems, so that should not allow to inhibit this neovascularization process. So we also use few treatments, natural treatments, to stimulate this neovascularization process. The moment neovascularization happens, there will be high influx of many nutrients that are necessary for remodeling and healing of the slip disc. The seventh process is called natural disc mechanics and movement by a few scientists. There is a natural movement in the disc that is happening during the day and night process. Like if there is pressure, the disc starts becoming bigger, more flatter. During rest and in proper posture, the disc starts growing by height and starts getting accumulated, and there is healing response inside also. So we can stimulate this process of natural movement so that the disc starts shrinking slowly from the prolapse state. So if there is slip disc, it can come to the normal position through natural mechanics and disc movement. For this, we may ask you to follow some proper posture. It might differ person to person, disease-wise and condition-wise. And we also will teach you a few but vital exercises and glides that helps and facilitate this happens very faster. Okay, so this is also one mechanism that helps to heal the disc by itself. Another healing response depends upon the complexity of disc prolapse or disc displacement or slip disc. There are many phases of disc prolapse. Sometimes there will be just bulge. It can heal spontaneously within days. Sometimes there will be minor protrusion without major rupture. That also can heal within weeks just by itself, but with proper guidance, of course. And if there is complex protrusion or extrusion or sequestration means the part of the disc falls down inside the canal, this might take a lot of time. Not only this, not only the stages of disc prolapse, there are also where the disc is going, which area it is impinging upon, which area it is going towards to. So that also decides how faster you are going to heal. In my personal experience, the posterocentral, if it goes directly behind towards your spinal cord, that might take a lot of time. In my experience, I have seen patients taking 3 to 4 years for complete healing, while taking another MRI, I see them doing fantastic. It might take few months to few years also. That is posterocentral. If there is lateral prolapse, if it is going towards side, if the disc is moving towards side or there is rupture towards side, it might heal faster. I have seen patients healing within days to weeks if there is sideward disc displacement. So all these factors are also taken into consideration while we are stimulating the self-healing of disc rupture or disc disease, or what you call ruptured disc or nerve impingement. So slip disc is a complex mechanism. Expert needs to decide whether how much time you have got, whether your occupation is right, whether your bed or mattress is right, whether your diet is right, whether you are obese or your lack of fitness is hindering the healing process. So all these things needs to be evaluated and needs to be addressed efficiently for efficient and faster healing process. We also guide you according to your nature or constitution. There are different herbs that can be used. There are different natural treatments that can be used also. We also take care of your pre-existing conditions. This will help the disc prolapse or the slip disc or nerve impingement to heal very faster. I hope this episode was helpful to you to understand how the disc prolapse or nerve impingement or impinged nerve can heal all by itself and how it can be stimulated. If any questions, you can always contact me. Please subscribe.